This is how I'm able to identify some of the most elite hearing care professionals in the entire world. Hey guys, Cliff Olson, Doctor of Audiology and founder of Applied Hearing Solutions in Phoenix, Arizona. And in this video, I'm going to show you exactly how I vet each and every member of the HearingUp Network to make sure that you can find an excellent hearing care professional and how I keep them accountable once they're in. So back in 2019, I was faced with a pretty large problem. My Dr. Cliff AUD YouTube channel was growing pretty quickly. And along with this growth came a dedicated subscriber base of individuals who were looking for hearing care professionals who also followed comprehensive audiologic best practices so they could get the most out of their hearing aids as well. But that wasn't the problem. The problem was my channel viewers had no clue where to go to find one of these extremely rare providers. I hate to say it, but there's estimates that are out there that suggest that less than 10% of hearing care professionals actually follow best practices. Now, just in case this is the very first time that you're hearing about best practices, just know that there are a series of considerations and procedures proven by research to result in higher level treatment outcomes. And if a hearing care professional does not follow best practices, there is no guarantee that you'll actually hear any better with your hearing aids. So with the help and insight of some of my more experienced colleagues, I decided to form a network of hearing care professionals committed to following these best practices. With a vetting process that is so strict that only the best, most committed hearing care professionals would even be eligible. And with that, I created the HearingUp Network. HearingUp is not just another clinic directory. Every individual provider is screened for their qualifications, access to equipment, and their commitment to audiologic best practices. And after they're admitted to the network, they're continuously held accountable after they join. With that said, here's my process for vetting hearing care professionals as they attempt to join the HearingUp Network. First, every hearing care professional who's interested in joining the network has to take my onboarding webinar. In that webinar, I discuss the purpose of the network and all of the criteria to join, which I'm about to go through with you right now. Following the webinar, they must complete a quiz to ensure that they understand every requirement of being in the network, and they must pass this quiz with a 100% score. Second, each prospective member submits an application that includes the following: proof of a state license as either a master's or doctorate level audiologist or a board certified hearing instrument specialist. If a hearing instrument specialist is not board certified, that's okay. As long as they've completed a 2-year hearing instrument sciences program, they're also eligible for admission. They then have to provide proof of equipment calibration that includes an audiometer, a hearing instrument test box, and a real ear measurement system, which is all required equipment to be able to complete comprehensive best practices. The application also requires 7 affirmations to confirm their commitment to the following. 1. Follow comprehensive audiologic best practices as outlined inside of the HearingUp Best Practice Checklist. These checklists were based off of the guidelines that have been published by AAA, ASHA, and IHS. Number 2, they have to act as a fiduciary for their patients, meaning that they always have to make decisions that are based off of their patient's best interests, not their own best interests. Number 3, they have to have the ability to dispense at least 2 different brands of hearing aids to try and prevent manufacturer bias as much as possible. Number 4, they have to commit to never dispensing locked hearing aids that prevents patients from taking their hearing aids to different clinics to have them serviced. Number 5, they have to be willing to adopt new best practice guidelines when those new guidelines are published. Number 6, they always have to uphold their state licensure agreements. And number 7, they have to agree to allow us to do a future on-site visit of their clinic. After prospective members complete and submit their application along with their application fee, it is reviewed to confirm that all of the affirmations have been signed and that they have all of their equipment calibration records up to date. After this review is complete, each applicant is scheduled for a Zoom interview with me. These Zoom calls are an opportunity for me to get to know each potential member, to see what their level of commitment to audiologic best practices are, to identify if there were any best practices that they were not performing in their clinic before applying for the network, and uncover if any of these best practices are not being adhered to. This ensures that they're not just checking boxes to get referrals from my YouTube videos, and that they actually know how to execute best practice audiologic care. Now let me tell you, if someone is not following best practices, I promise you it is very apparent in these interview calls. However, by the time someone usually gets to this part of the process, it is rare that they're not meeting the requirements. Of course, I have denied membership to a handful of applicants primarily because it was very apparent that they were not following best practices yet, or they had just recently adopted all of the best practices, but they were not yet confident in their execution. In these particular cases, I always encourage the hearing care professional to go back and make sure that they're implementing all of the best practices and to make sure that they're confident confident in doing so. Once they've done this, they can reach back out for another Zoom call. Now, after someone has gone through this entire application process and has completed their phone call with me, and I feel comfortable admitting them into the network, we send them a welcome email where they can sign up. And yes, each and every member of the HearingUp Network does pay membership dues. Those dues are the same whether they receive 500 referrals from my YouTube videos or whether they receive no referrals from my videos. After a member joins the network, we go to work to build their provider page that we host on HearingUp.com. So when you go to HearingUp.com, you can go to the provider locator, search for the provider in your area, and schedule an appointment. Now that is the initial vetting process for every single member inside of the HearingUp Network. But you should be thinking to yourself at this point, well, that's great, but what do you do to provide ongoing vetting for these members? Well, getting into the network is one thing, but staying in the network is another. And I'm happy to say that this level of oversight is completely unheard of in the world of hearing care, where individual providers are almost never held accountable. And it all starts with the individual who has hearing loss. Now, as you're aware, when I developed the HearingUp Network, I created a series of best practice checklists. These checklists are available to anyone, and they can be downloaded directly from my HearingUp.com website. Everyone thinks that these checklists are for the hearing care professionals, but they're not. They're for the individuals who have hearing loss to make sure that they can hold their hearing care professional accountable for completing all of them. You see, if an individual who has hearing loss prints off these HearingUp best practice checklists and takes them to a HearingUp provider, that provider knows that they're going to be held accountable. Now, to make sure that these providers don't just check off the boxes without performing them, each and every best practices has a video on my YouTube channel. This way you can educate yourself on what the best practice is to ensure that the provider actually did it. Now, trust me, at the end of the day, I wish I did not have to rely on the individual who has hearing loss to ensure that their provider is doing the right thing, but it's extremely powerful. Now, if a patient truly believes that they did not receive best practice audiologic care from a HearingUp Network member, they can always go to my HearingUp website and provide us with feedback. This is also why I vet individual clinicians instead of clinics, because I can actually hold individuals accountable. If a complaint is submitted, I always reach out to the individual who submitted the complaint to make sure that I fully understand what their concern is. Once I find out what their side of the story is, I reach out to the provider and let them know of the complaint. Oftentimes, these complaints are just misunderstandings. For example, if you schedule a consultation appointment with a HearingUp Network member and they do not perform real ear measurement at your consultation, that is not a violation of best practices. Real ear measurement is a best practice that is used at a hearing aid fitting, not at a consultation. However, if a complaint is legitimate and we identify that a HearingUp Network member did not follow best practices, that is a strike on them. If a provider receives 3 strikes, then they have a formal interview process that they must go through to ensure that we're on the same page of them being in the network, and if they're not, then it's time for them to leave the network. Fortunately, the feedback that I typically get from individuals who go to see a HearingUp Network member is overwhelmingly positive. And yes, I do pass on that positive feedback as well. Now, I should mention that there are some excellent hearing care professionals who follow best practices that are not members of the HearingUp Network. And if you're able to find one of those providers, by all means go to them. This network is not intended to be a comprehensive list of every single provider that follows best practices in the world. However, it is intended to help you find one of these excellent hearing care professionals, many of which have been following best practices before I even became an audiologist myself. And it is much easier than trying to find one of these excellent professionals on your own or just getting lucky by stumbling into one of their clinics. At the end of the day, if my vetting and accountability process is not enough to give you confidence that you're actually seeing one of the best hearing care professionals in the world, then I encourage you to educate yourself on what all of the best practices are so you can do your own vetting. Because if there is one thing that I've learned after being in this profession for 10 years and interacting with thousands of individuals online, it's that your hearing care professional can make or break your success with hearing aids. And if you want to hear your absolute best, then you absolutely have to find a hearing care professional who is 100% committed to following audiologic best practices.